Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society. And I was thinking the other night about the marvelous way that the human beings are made. It is unreal how wonderful we're put together. And when you go and do surgery, and I've scrubbed in on these surgeries where we take the whole maxilla loose and shorten it to reduce this face that's gotten out of shape simply because we breathe different, or we breathe the wrong way, or do something the wrong way. And it's so marvelous how it's put back together and it grows back, and it's unreal. So I'm going to just talk about that to some extent here today and kind of show you a few pictures as we go along here. This is the picture now, just of the jaw on the side, just looking at it. Now, I bought this skull years ago, which is actually a human being's skull, and this was taken apart and cleaned up and everything, and it shows you how things really are. And they stopped doing this. I don't know where they got the skulls from, people that maybe they put folks up and they let them float down the Ganges River, and I think they were taking some of these people and going in and cleaning the skull up completely and showing you all these points. It is marvelous the way the skull is made and the way the bones are made. And if you look at this, I'm going to just get something here and point where they are. Now look down here that the roots, the cortical bone is this hard bone right here. And then we have, you take that cortical bone away, and there's what they call cancellous bone in here. And the teeth have their roots down here in the cancellous bone, but they go through the cortical bone. And so when you move a tooth, if you can move it around, the cancellous bone is easy to move through, but the cortical bone is tough and harder. But you can just put a gradual pressure on this, and you can move that bone structure as long as a person is alive. And for a long time, I mean, people said, well, you get a certain age, your bone doesn't move, and you can't move your teeth, you can't straighten them. But this is false. And I've found out you can straighten somebody's teeth as long as they live. As long as they're living, this bone structure can change, and you can move it. Let's go ahead and I'm going to show a whole bunch of pictures. And this is nerves and blood vessels. And they took this and illustrated that with blue and red threads. Also a lymph canal. Every tooth has 3 of these things going up inside what you call the nerve part of the tooth. And as you get older, this dies away. And I had some teeth worked on here a few years ago, and at my age, the nerve is just receded and it's gone. There was no nerve in the tooth, and they could feel it without any anesthetic at all. And but this will still move on the outside, and you can move teeth around any way you want to get them to where they normally fit together. And the way people breathe and the way they swallow makes a difference in the way this shape of the face is. Let's get on with some other pictures here. Here's a little close-up now. When your teeth are together down here, your condyle doesn't touch up here, and this is the fossa right here, and this is the temporal bone, and this is what we call the TMJ, the temporomandibular joint. And this is the most complicated joint in the body. And in reality, there's a disc that fits around here and comes in. It is a double concave disc. And as you open the mouth down here, this condyle slides forward here, and this disc slips along with it. And this disc takes so much pressure right in here till there's no blood vessels and no nerves in the center part of this disc. In other words, it's a kind of a thing like this, kind of double concave, and this portion in here has no nerves or no vessels, nothing in there to feed that. So it has to be fed from outside. And then when you close this together, it squeezes and mashes this retrodiscal tissue up here, and fluid comes in here, synovial fluid, which feeds this and lubricates this joint. And every time you open and close your mouth, this joint slides back and forth in there. And I'm 96 years old right now, and this joint is still working. And it's been there since before I was born. You see, it's been that long. And that tissue in there is still there. Now you can damage it very easily by somebody getting a blow, hitting the jaw out here, and the jaw is just hanging on to the skull by tissue, and it'll jam this condyle back into that retrodiscal tissue, and that's where this gets swollen up. In other words, you damage it, you hurt it, it swells up just like any other thing. So if you get in an accident and you can keep this cold, keep it from swelling, well, that would help, but you can't. And so now it swells. Now you have to eat, and it's pushing into a sore jaw joint material in between there, and that irritates it. And if you continue to do this day after day and you've got a sore joint, the pain radiates to different parts of the neck, the shoulders, and the body. And this is how this pain from the jaw joint kind of fool people. Their jaw would be hurting, their head would hurt, their shoulders and neck. It's just, that's the way this would be crying out that this is wrong right there. Let me erase that now, and we'll move to something else. But this is marvelously made, and it lasts the whole lifetime if you take care of it properly. That's why you want to bite on something, you make a mouth guard in here. That's if you're playing some rough sport or something like that, you want a mouth guard that you can bite together and hold this together. So if you get a blowout here, this holds it in place and doesn't let the condyle jam up into that socket up here where this is operating. Now when you open the mouth, this will run right out here, and sometimes it'll go up and the condyle will get out here. You got to push down on it and get it back in. That's a pretty rare thing to happen. But people get hit with a car from the backside, and it jams this back, and they'll have a retrodiscal tissue be damaged in that kind of accident like that. So this has a lot to do with how people get along. You need to, if everybody working on the teeth ought to know how to take care of this portion of the jaw. Now your muscles hook in here and hook up and go up in here, and they pull the jaw back and forth millions and millions of times. And that goes back and forth, back and forth, back and forth. and I'm doing that for 95, 96 years now, and it's still working. And I guess if you could live to be 120 or 30, it would still work, as long as you take care of it properly. So anybody in any kind of sport ought to be wearing a mouth guard. I don't care what kind it is. I had a little niece playing basketball. Somebody hit her in the chin with her elbow, and it jammed this back up here, and this was inflamed, and it hurt for a long time till I got her, moved her jaw forward and put a splint in there and kept it off and let it heal up, and then we could let it go back, and it worked all right. So this is something that you need to, people just need to understand about how this works. And so I hope that you can look at these things. Everybody, in fact, they won't even, you can't buy a skull like this anymore. And that is a shame. It would be better that everybody studying dentistry, medicine of any kind, needs to know how the body works exactly. And that tells you what's wrong. You can look at it and find out things like that. I'm going to erase that, and we'll go on here to something else. Now here's a close-up of this cortical bone now, and this is the way the teeth contact right in this area right here. Now as you chew, these teeth move. They move up and down. The tooth is set in the socket. It has, let me go back that up just one more time here. When you bite down, there's a periodontal membrane around the roots of the teeth. And I'll just draw something big here and show you what this periodontal membrane. Now, this is the root of the tooth, goes in here. And the bone structure would be around this tooth, like that. Well, in this area right here where the root and the bone structure comes in contact, we'll just make a big drawing of that. Now, this space between the root here, this would be the root of the tooth, touching, and this is the bone here. The bone is not against the tooth, but this will be cancellous bone up against this fairly close, and this is the cortical bone, which is much thicker out here. But between this will be just millions and millions of little fibers that attach the tooth to the bone, tooth to the bone. I mean, if you can visualize this, millions of little fibers, and that gives a cushion to this. So when something, you bite down, this tooth will give a little, and those little things stretch or move out, and that is what they call the periodontal membrane. And that is a delicate portion, and as long as there's a vital periodontal membrane, you can put pressure on there and you can move that tooth, and the bone will move, the body will pick the bone up and move it along, and you can move that tooth around, and in the mouth you just take a little time to do it. But if you get this damaged and the periodontal membrane is mashed or squished, sometimes the bone will grow straight to the tooth of the root of the tooth, and that tooth cannot be moved normally. So you have to break it loose. You break this contact loose, and then you can move the tooth. But that's where you have an ankylosed tooth in the mouth. It's kind of like the screws put in the bone, and it won't move, except you just move the whole bone. All right, we'll leave that alone and get back over here. Now that's the tooth just pulled up real big so you can see how the teeth meet together in there. It's better to chew where you can chew back and forth, and the jaw is made so you can go from one side to the other, and I can bite on one side and the other side doesn't touch because the condyle slips out of the socket and disengages the teeth on one side. All right, here again is a blown up section, and these little threads represent a vein and an artery, and there's a lymph vein that they don't even bring in, and they go all the way up inside the tooth, called the pulp of the tooth. And if this may die or get irritated, you may have to have a root canal. And they clean this all out and pack it with something, and the root canal, the tooth is dead on the inside, but it's still alive on the outside, and so you can move a dead tooth any way you want to. All right, this look like that. This a little better, give you a view of this cancellous bone. Now the body doesn't waste this, but we make the blood vessels and we make different things inside the body that is made inside the bones and in the cancellous bone. There's blood supply and everything in there where that grows and changes, and we produce blood cells and everything. It's made inside the bones. All right. Now, if I'm looking at just looking straight at some skull, if you had this tissue off the skull, you've got a nasal septum running down through here. This is just a bone that holds the different parts apart. And we breathe air through these turbinates. There are 3 turbinates in there, and these are our airway. Now, if you can visualize in this, there are millions of little fibers comes out in here. And those fibers stay straight, and they stay moist all the time as long as we've got enough moisture in the body. And you can breathe through your nose all night long and it'll stay moist. But if you open your mouth and breathe through your mouth for just 10, 15, or 20 minutes, and your mouth will dry out, just get so dry, I've waked up, and your tongue will be so dry you couldn't hardly talk until you got it lubricated again. And there are 3 of these turbinates. Now, if you visualize tissue over these turbinates and all these little cilia coming in like that, and they're still kept wet, and now you breathe through a normal mouth with plenty of air space in here, and these little cilia. And I have, as younger, was working in the hayfield and breathing dusty air, and you would cough up or you would spit out or you blew your nose and there'd be dust, dirt, and all kind of mess coming out of your nose that these cilia caught. They would catch on that and the air would go on through. So in something like that, you would always want to breathe through your nose to catch as much of that junk as you can. If you suck it in and the air goes down into your lungs, this gives you problems. And so you want to be able to breathe through your nose. And breathing through the nose is the healthy way, except when we have to really exert ourselves, then we dump air in to get as much oxygen as we can possibly get in here, but we risk sucking in air that is dirty. It's got stuff in it, every kind of thing you can think about, and we catch it in the nose, and if it finally goes back here and we swallow most of it, it goes into the stomach, and the acid in the stomach kills the bacteria that comes in that way, or it tries to. So these turbinates and the little cilia are a very important part of our health. I've had kids that breathe through their through their mouth, you know. Had a little boy, and he was having lung trouble. And we separated his palate and moved it apart and put it back where it should be. And then he could breathe through his nose, and the lung problem went away, like that. Now, if a person is a mouth breather, the tongue stays on the bottom arch. In other words, and this down on the bottom if I'm breathing through the mouth. And so your lower teeth will spread out just from the pressure of the tongue, pushes the lower teeth out, and I've got case after case of people who are mouth breathers, and you look, their upper teeth are kind of meeting inside the lower teeth, or they're too small in there. And that is affected because they breathe through their mouth instead of their nose, and they don't close close the teeth together like they should. This is so much to learn, and I hope that people everybody living ought to know a lot about this, and you can go and look up now with artificial intelligence. They'll tell you pretty much the answer that we know, if we know the best answer to most any problem you come up with here. All right, let's go on from the turbinates. And sometimes people go in and have the airway is just too full of material that they can't get enough, so they'll come in and freeze a portion of the turbinate and then take that part out and open it up. But you have to be careful, because you don't want to just open your airway completely, because it won't be able to filter the material coming into you, the air coming into your lungs. Okay, this is just a joint right off the bat. I can't recognize what that is, but this is the turbinate. And sometimes the turbinate will get bent over and like that, and you can't breathe through one side, and the other side you can breathe through that. And this is the septum coming down that separates the two, right and left nasal airway. And this is just a picture here. It's not, I don't really, this is looking up in the palate. This is inside the mouth, and this is the central teeth coming out here. This is a nerve, comes in through the tissue. There's an opening on every body, and the nerve comes in and supplies the tissue, and also comes to and supplies the teeth. And these are the two central teeth coming up like that. Now that skull is just cut in there, and you can see where it is. All right, here is where we put, this is one side of the mouth. Now, when you're looking at somebody, think about both sides. I mean, think in 3 dimensions more than just 1 dimension. It's not a flat thing. Now, for a long time, we put a separated deal in here, and we put deals coming off, and we catch these teeth on each side with a separator, and it pushes us apart, trying to separate this septum and this bone structure right here. And for a long time, this would come out to the other side. I asked the gentleman, Timms, from England, who came up with separating the palate on kids where they breathe through their mouth and their palates were too small, and you had to enlarge that. And he's how old he could separate this palate and get these sutures to come apart. They would just come out like this. And he said about 17 or 18, and you can't get it because he was pushing back here. Well, I came up, and I had been separating people in their 30s and their 40s, some in their 40s. But what I was doing, I put pressure between the centrals over here, and this is where the main part of the bone is, and we're trying to push this apart by pushing it in this area, and you can't get the force over here. And by doing that, I was able to separate people in their 30s and a few of them in their 40s and bring it out like that to widen it and restore it to where it normally would grow. And there's just so much to understand about this when you go to moving this teeth and everything around. So I'm going to pick out, let's go down, and here's another view of the turbinates. Right in here, and the airway coming up through there. And this jillions of little hairs that are kept moist in there, and they stay moist all the time unless you're just really out of liquid in the body. And that is you catch that. And there's the jaw, and where it's joined in here. And you open this a little bit, and this condyle will move over here, and this teeth will be down here. And you can open and close, and you can chew on one side, you can chew on the other side, or you can slide forward and bite your front teeth, and you bite your front teeth together out here. This will come out here. Nothing will touch in this area except the front teeth, and you're biting on the pressure there, and the pressure will be right in here on the disc. And that's why you don't bite hard out here. The muscle is picking the jaw up in this area. The temporal muscle comes out in here, and it's real stout muscle. It'll pull up with a tremendous amount of force. And if you have, say, 10 pounds of force out here, this may have 20 or more pounds of force up in the jaw joint where the muscles pull on it, because the distance from the muscle to the joint here and to down to his out here. And so this, to bite hard out here, you have to really put a lot of force on that. So you don't bite hard out there, you bite back here, and that lets the force go up and down in between these teeth, and that saves this. And so you're going to crack a nut or you're going to chew something hard, you go back in the back of your mouth, and that's closer to where the muscles are, and you can crack the nut back here, but that's not good to do. So I'm going to get on from there. Now, here is the ear is extremely close to this. The retrodiscal tissue is squished up in here, and it feeds this jaw joint right here. But if you get a hard blow to the chin out here, and it shoves this condyle back into this too hard, this is the opening of the ear, and the bone structure between the fossa and the brain is right up in here. And that way you hit somebody in the chin, and it jams this up here, and it shakes the brain up, and the person can be knocked out. I fell once and hit my chin hard, and it knocked me out, and I lay out for a while. I finally came to. But it was, in other words, if you had a mouth guard, you could take the same force and it would not knock you out. But you didn't have anything, and it shoved this back, and it mashes that tissue, and it doesn't have much bone structure. In fact, you can take a skull and you can shine a light through that. The bone is very thin where it comes close to the brain. All right, here's a jaw, and this is where think of one of them, you think of both of them. The jaw is just one bone, and it's held over the skull by tissue and ligaments holding it together and everything. And that's a condyle. And it's fixed so you can move from side to side and still have this disc. We call it a disc. It's something that fits like that around it, and it has a thicker outer deal all around, and it's real thin in here. But this thin stuff is tough material, but there's no blood vessels and there's no nerve endings in here. This can die and you won't even know it. If you tie the jaw together and don't let this get fed, this part of this will die right in here, and you won't even know it, except you'll start feeling it changes the height between the teeth and everything. And that's the way it's put up on that skull so it can be function. Okay, I realize that people looking at this ought to understand how your jaw works. In other words, you can chew one side and this doesn't touch. And chew the front teeth and nothing touches on the side except the condyle comes out of the fossa and it comes in and touches there when you open your mouth and do that. And you can bite something off out here in front, and then you can close back and you can chew out here and bite hard, and it doesn't put any load on this. And understanding how this works, you can understand how the TMJ is connected to the teeth, and everybody messing with teeth ought to understand what goes on up here as well as down on the teeth. Now, now we split the teeth, how they did this with a fine saw. And now, here looking at split teeth, you can see the canal, and that's where the nerve in the tooth is. I'm going to close out now. This is just a fraction of the marvelous way that teeth and the human body is made, and we're able to take it apart and do the work on it and put it back together and make the chin stick out or bring it in. All of these things can be done, and you put it back together and it'll grow back like it is, like it'll grow where it functions like that. And it is absolutely marvelous the way the human body works. And I'm going to hush up now, but if you are interested in this, you can study it more. But my feeling is that we should give everybody that goes into dentistry and medicine in any way connected to stuff, they should have a human skull instead of just throwing these things away, letting people, rather than that, cleaning it up, let somebody study with that. I have enjoyed knowing and keeping this skull, and it is not legal now for people to prepare that skull, but it really should be. So I'm going to say goodbye. Thank you for watching, and I hope you'll tune in to our channel, and I'm going to try my best to give you an honest answer to many of the dental and problems related to orthodontics, the joint, and the whole thing put together. So thank you for watching, and I'll hope to see you again. I'm saying goodbye.